Good morning, everybody.
Good morning.
I want to thank all of you for joining us. I'd like to recognize Cook County Health Chief Executive Officer Israel Rocha and Cook County Department of Public Health Chief Operating Officer Dr. LaMar Hasbrouck. Today I'm proud to announce that Cook County Department of Public Health is providing grants through its Building Healthier Communities Behavioral Health Initiative. A mouthful. Building Healthier Communities Behavioral Health Initiative. This is $14.7 million in grants to 18 community-based organizations and agencies. The funding will go toward behavioral health services, positive youth development, and opioid overdose prevention and harm reduction programs throughout suburban Cook County. These awards range from $250,000, $250,000, to over $1 million, and will be dispersed over a 4-year period. This initiative strengthens our commitment to promoting and building health equity across Cook County. It focuses on the significant and negative impact that inequities in mental health and substance abuse have on people and communities in suburban Cook County. COVID-19 has been tough on all of us, but for our children and adults who are struggling with or at higher risk for mental illness or substance abuse disorder, the uncertainty, disruption, and constraints on our social lives have been especially challenging. People experiencing new mental health symptoms have also found it hard to get the help that they need. To address the inequities, this initiative is focused on increasing and enhancing access to a full continuum of integrated and equitable behavioral health and substance abuse services, support, and treatment in suburban Cook County. Using funds from President Biden's American Rescue Plan Act, ARPA, Cook County is committed to supporting essential behavioral health and harm reduction services and programs to meet the immediate and future needs of suburban Cook County residents. Now, before I ask our CEO, Israel Rocha, to come to the podium, I want to acknowledge Irene Lopez, who's here on behalf of Commissioner Anaya, and David Evers, who's here on behalf of Commissioner Deere. We regret that the commissioners could not join us. We're grateful for the presence of their staff. CEO Rocha.
Thank you, Madam President. Thank you, Madam President, for your introduction, and also, most importantly, for your commitment to improving health here at Cook County. As I said, I'm Israel Rocha. I'm the CEO for Cook County Health. I'd also like to thank Commissioner Deere, Anaya, for their representatives who are here with us today, and for their continuous support of our health system, as well as Dr. Hasbrouck, who is the Chief Operating Officer of our Cook County Department of Public Health team, for their great work in the grant program that we're here to announce today. The vision of achieving health equity for all health residents of Cook County drives all of our work. The grant program will allow us to support organizations in effecting positive change and implementing behavioral health strategies at the community level in areas where they need it most. The initiative called on community-based organizations and healthcare providers, social service organizations, and education agencies, as well as local governments in suburban Cook County, to work in partnership with the Cook County Department of Public Health to develop and expand our culturally responsive, inclusive, and community-led prevention, treatment, and support services programs. Addressing inequities in mental health and substance use is not an easy task. It is going to take expertise, resources, creative interventions to address the growing behavioral health needs that our communities and our residents encounter. We recognize that community-based organizations and agencies have extensive knowledge of the needs of our neighbors, our community residents, as well as the social risk factors that can be barriers to well-being and seeking health access. By collaborating and funding with hyperlocal work, we will improve health and well-being of Cook County residents that we serve today and for generations to come. Now I would like to say a few words in Spanish. Me orgullece anunciar la concesión de más que 14 millones de dólares en subvenciones a organizaciones suburbanas del condado de Cook. Estas subvenciones apoyarán programas que brindar servicios de la salud del comportamiento y contribuyen al desarrollo positivo en jóvenes y abordan a trastorno por el uso de sustancias. Esta investidura es muy importante. La salud de nuestra comunidad y de nuestros residentes es la más importante que podemos ganar en nuestra comunidad. Y de una organización de salud, estamos haciendo estas soluciones en apoyo con nuestras organizaciones que saben a nuestros pacientes, a nuestros residentes, a nuestras comunidades. Ellos saben lo que encuentran nuestros pacientes y nuestros residentes en vivencia y en ganando salud. Y estamos muy orgullosos para poder anunciar esta subvención, para poder apoyar los servicios, para ser más fácil para residentes a accesar el acceso de salud que necesitan. Now I'm very happy to bring forward Dr. LaMar Hasbrouck, who is the Chief Operating Officer of the Cook County Department of Public Health, to say some words on this very special day. And thank you for all the leadership of your team and everything that has been able to take part. I know it was not an easy task to get here today, so please thank you for your leadership and for all the work of your team.
Thank you. Thank you again, Mr. Rocha, and thank you, President Preckwinkle, for all of your support in helping support us in our mission to put the public in public health. So we're very excited about this announcement today. So I'll just say a few words, and then I get the fun part of introducing the awardees for this grant program. So first of all, good morning, and I'll say that. Good morning. I'll say that last October we announced an open call for all partners in the community as a part of this Building Healthier Communities opportunity. What we received was an overwhelming response. We had 140 applications requesting over $120 million for a $14.7 million allotment. So that just kind of gives you a sense of the scale of importance, but also of enthusiasm around this. So I want to take a moment to thank all of those who are working on the front lines to address behavioral health needs of so many. Obviously, we couldn't afford to fund all of them, but we want to thank them all for applying, for attending our workshops, for sharing their work and their vision, making it transparent to us so we can know how we might help them in the future. And we know that historically, mental health needs of many folks in many communities are really underserved. And the demand for services often exceeds the supply of qualified health professionals. The pandemic has exacerbated this mismatch, leading to unprecedented need and prolonged waiting times for all of those who might need these services. But as often is the case, part of the solution lies in harnessing the power of partnerships. So we're looking forward to working with our community partners to help meet the critical needs of our residents and their families and help them chart a healthier path forward. And although, again, we're unable to fund every applicant, we value every organization that is making life-improving and, in some cases, life-saving contributions. With that, we want to congratulate and announce the 18 awardees of the Building Healthier Communities Behavioral Health Initiative. So we had three categories. The first category is mental health, and we had eight awardees in this category, and they are Hoffman Estates Department of Health and Human Services, Shelter, Inc., Black Alphabet, YWCA of Metropolitan Chicago, Arab American Family Services, Legacy Medical Care, Asian Health Coalition, and NAMI, the Metro Suburban affiliate. Yes. In the next category, we had 7 awardees that are focusing on positive youth development. And these are the Kenneth Young Center, Playworks Illinois, Northwest Center Against Sexual Assault, Girls on the Run Chicago, Pillars Community Health, Big Brothers and Big Sisters, and Youth Guidance. And then finally, in the last category, which was to focus on opioid overdose prevention, we had 3 awardees, and they are Family Guidance Centers, Housing Forward, and Proactive Community Services. So with that, we will open up. I'll give the podium back to the president, and we're open to take any questions that you all may have. Thank you.
Thank you. Nick? Times. Thank you. Thank you.